Good evening. Thank you for joining us. I'm Yoon Jung-min. The shortage of medical personnel due to the mass resignation by trainee doctors is beginning to have a larger effect on healthcare, possibly over the long term. To tackle this, the government is allocating funds worth over $140 million per month. The role of nurses will be expanded starting tomorrow. Shin Ha-young begins our coverage.
The government announced additional measures on Thursday to tackle the ongoing shortage of hospital physicians as thousands of junior doctors have continued to refuse to return to work. As part of these, 188 billion Korean won or around $141 million will be allocated monthly in extra spending on healthcare using money from the state health insurance fund.
The government will establish funding to support enhanced coverage of the hospitalization of severely ill patients and provide extra compensation to doctors who care for patients in intensive care units.
This follows the announcement the previous day of $96 million in contingency funding to ensure that emergency care and essential services remain in operation. To further address the disruptions of medical services, the Health Ministry released guidelines on Thursday that will expand the role of nurses. Starting Friday, they will be allowed to perform certain emergency procedures that they have been trained for without the supervision of doctors who would normally order them. Regarding this, the Korean Medical Association voiced opposition to the measure, expressing concerns that it could result in legal malpractice suits from patients who had undergone illegal medical practices at medical sites. During a meeting of the Central Disaster and Safety Countermeasure headquarters on the same day, the Interior Ministry said it would push for the enactment of a law to ease the burden on doctors and other medical staff facing such medical lawsuits from patients. Meanwhile, according to the Health Ministry, as of 11 a.m. on Wednesday, more than 90% of resident doctors from 100 major hospitals, over 11,000, were still absent from their posts nationwide. Shin Ha-young, Arirang News.